And I'm so sorry I can't be there in person, but we'll make do with the best we can in 2020.
Okay.
So it looks like you've got some of the Hibiclens and hubs there, and
Yes.
I have to apologize. I'm on the road, so I'm using this pack as a hub stand-in. I thought for sure I had one in my car, but I don't. So first of all, Hibiclens, the active ingredient in this is CHG, chlorhexidine glutamate. And the reason we use it to bathe patients is that CHG binds to the proteins on your patient's skin, and it will kill microbes for 24 hours. So it's not a bath, it's more of a bath with benefits. It provides an infection prevention treatment that helps protect your patient against healthcare associated infections for an entire 24 hours. That's why it's critical that we get every patient every day and get them their Hibiclens treatment. The great thing about CHG is when it binds to the skin, you can't wash it off. It's that bind binds so strong that it's going to stay on that skin. The challenge is you can neutralize its effect, and you do that by using lotions, especially the lotions from home. Now, what you have in-house, we vetted it. They're designed to work with CHG, but that's why we always say, you know, I know you love your smelly lotions from home, and that kind of makes your loved one feel more like they're at home, but it offsets all the benefits that CHG gives them. So we really want to stick with the lotions that the hospital provides if your patient needs a lotion. Other than that, the process is very simple. This is just a bath, and we're replacing the soap with Hibiclens, and we're utilizing the hubs as your disposable basin. So it's all in one. First step is to get your hubs pack and add enough bath temperature water to get the wipes wet. We say about 16 to 20 ounces. The amount isn't critical, just enough water to saturate the wipes so you have wet washcloths. This is going to last 3 to 4 patient baths. So when it goes in the patient room, go ahead and put the patient sticker on it, and that belongs to the patient. If they're transferred, if you're in the ICU and they go to a step down, this can go with them. So it can follow them throughout the hospital. The process is really simple. We want to put, that's hard to see, we want to put the Hibiclens right on a wet washcloth and wash it directly on the patient's skin. In the past, I think some people have put it in the hubs pack. We don't want to dilute that because it dilutes the efficacy. We want it to hit the skin full strength, wash it on, and then just get a clean, moist cloth and rinse it off. So this is just like any traditional bath. You wouldn't get in the shower at home and suds all up and then come to work without rinsing the soap off. You do want to rinse the Hibiclens soap off. And the benefit is that CHG stays behind because it binds to the skin immediately. It binds to the proteins on the skin. So you can't wash that CHG off. It's not going to leave a sticky film or residue on your patient at all. If your patient does feel sticky, then you haven't rinsed quite enough of the soap off. So just be cognizant of that. We want to use this from the chin down. There is a better saying out there, and I've been doing this 15 years and I haven't found it. But my saying is, if it's skin, it's a win. There's got to be something better. But chin down, we do want to keep it out of the eyes, ears, and mouth. But everything that's intact skin below there, we're going to wash. When you're doing your bath, it's critical to get the patient's hands. Sometimes that patient can't get up and do their own hand hygiene. So you want to make sure that you get that 24-hour protection on their hands because that's what's going everywhere on their body. Some people get real excited in the genitalia area. There's a lot of I think, undue controversy. In the genitalia, if it's skin, it's a win. So we're washing the outer labia, and on men, we're washing the scrotum and the shaft of the penis because that is skin. We certainly, same process, wash the soap on and then rinse it off. One of the other things we're doing with Hibiclens is line care. So we want to wash the first 6 inches of any catheter, any central line. Same thing, soap on, and then rinse it off. Wash over stage 1.
Oh, Matt.
tissue.
Okay, there you go. We lost your voice for a second.
Uh-oh.
There you go.
Where did you?
We're good.
Have you got me now?
Yes.
Okay. Did you get stage 1 and stage 2 wounds are fine?
No.
Okay. Did you get central lines and Foley catheters
Yes,
are fine?
we got that.
Okay. So the central line, first 6 inches, soap on, soap off. And then stage 1 and stage 2 wounds, you can wash over. Same thing, soap on, soap off. No deep tissue wounds, so no 3s and 4s, but you're probably gonna have a dressing on that anyway.
Right.
Just wash around the edge of the dressing. It's not critical to wash over the dressing, and your Mevalex dressings are fine. You're not gonna impede those at all. And do make sure that you are charting that the CHG bath has been provided, because we do want to track that. And that's really it. It's as simple as giving a bath. Chin down, skin it's a win, no lotions from home. And if we can remember those 3 things, then I think we'll be in pretty good shape.
Awesome.